Hello, my name is Phillip Noel, and I am here with the Virginia Community Healthcare Association. Today, we are having our next episode of the Maternal Matters Voices from Virginia podcast series. And I have a very special guest here with us today, and it is Congresswoman Jennifer McClellan. Congresswoman Jennifer McClellan, the first Black woman elected to Congress from Virginia, and a longtime leader on issues of healthcare, voting rights, and working families. She has spent years championing policies that aim to improve maternal health outcomes, especially for Black women in underserved communities. Congresswoman McClellan, thank you for being here.
Thank you for having me.
Happy to see you yet again.
Yeah, you too.
And for people meeting you through this conversation, can you share a bit about your journey into public service, as well as how maternal health became such a pivotal topic for you?
Yeah, so I got interested in government and politics as a kid, mainly through a love of history. My parents were a little older. They grew up during the Depression, during Jim Crow, and listening to their stories and my own study of history, I came to see that government at its best is a force that helps people and solves problems. At its worst, it's a force that oppresses some for the benefit of a few. And so at 11, I decided I wanted to be a part of making government that force for good, but I didn't know what that meant at 11. But I knew that I wanted to be involved. So when I went to college, I started volunteering on campaigns. I got internships at every level of government. And I originally thought I wanted to be a lawyer to a congressional committee. But I knew I was a Democrat. Republicans took over Congress. I didn't want to work for them. So I ended up going the law firm route, but stayed involved on the political side. And then 20 years ago, my delegate, Viola Baskerville, called. She had decided to run for lieutenant governor and asked, do you think you might want to run for office? I said, maybe one day after I get married, have kids, make money, retire. But she said that day is now, so I ran. And then I got married and had kids. I became the first member of the House of Delegates to be pregnant and give birth while in office. And that really brought to light a lot of the issues around how healthcare policy impacts the delivery of care and the doctor-patient relationship. And then, becoming pregnant and a mother really opened my eyes to a lot of the maternal health disparities. And then with my second child, we both almost died. And so that really made it personal.
And again, being the fact that you have this lived experience, right? And so was there a particular moment or another experience that it became clear that maternal health for Black women in particular is not an individual story, but a systematic one?
Yeah, I think it was a couple of things. I served on the Joint Commission on Healthcare. I was in the state Senate when we expanded Medicaid. And I was on the Health Finance Subcommittee in the Senate. Had been on the board of a hospital. I was on the board of a Medicaid provider, a state-run Medicaid provider. And I think all of the information that I saw really showed not only the disparities, but the reasons behind some of them. And it all boils down to access to healthcare in general. So the studies that we saw, particularly on the Commission on Healthcare, showed that for white women, they are more likely to die from suicide, from drug overdose, things that are rooted in underlying mental health problems that pre-existed their getting pregnant. For Black women, they're more likely to die of cardiovascular issues, which pre-existed their pregnancy. And so that really opened my eyes to the fact of these disparities don't begin when you're pregnant. They begin with, do you have quality access to preventative care? Are you living in an area that you're more likely to have poor health outcomes because of environmental justice issues. People in poverty are more likely to have worse health outcomes, and so that really opened my eyes to those systematic issues. And then there are, biases that impact medical professionals. Some rooted in the training that they got, and some that are just natural. So, there was a time when medical students were taught that, Black people don't feel pain the same as white people, or things like that, that lead to just bias in the provision of care.
Yeah. And one of the main themes of this series on maternal care is access. And you mentioned that a little bit earlier. And so we've been able to have a provider come in and speak, and we're hoping to also speak with patients as well on this particular topic. When you think of the word access when it comes to maternal care, what does that mean to you?
So I think it's the same as access to healthcare generally. It is, do you have the ability to go see a medical professional for preventative care or to treat whatever you have, but particularly when you're pregnant, to get prenatal care when you need it, without going bankrupt, without having to drive, an hour, 2 hours away. To me, that's the main issue. And can do you have health insurance?
Yeah, and we also, you've mentioned also as well, you believe in the full spectrum of care when it comes to that. And so where do you still see maybe any potential gaps in that full spectrum when it comes to maternal care?
Oh, there's so many.
Yeah.
I mean, it's everything from, do you have health insurance that covers preventative care, prenatal care? Do you have access to a hospital that is, nearby, that has a maternity ward, that has the prenatal care that you need when you need it? I said, do you have health insurance? That's a huge one.
Yeah.
And I think the system also traditionally has not focused on wellness and preventing illness, but treating illness. And I think we need to back things up a little bit and make sure that we are keeping people healthy, not just treating them when they're not.
Oh, yes. And nearly 2/3 of maternal deaths happen postpartum.
Yes.
And so what do we need to do better when it comes to supporting women after childbirth?
I think the first thing is making sure that they have health insurance that covers the first full year.
Okay.
Because it's huge.
Yeah.
And for a long time, Medicaid did not cover the first full year. Now it does. Now most insurance, if not all, covers the first full year. And again, making sure that before someone is pregnant, that their underlying healthcare needs are addressed. Because again, for Black women, it tends to be cardiovascular. I've heard stories of one woman who was 34 years old. She had her first heart attack.
34.
At 34, postpartum.
Oh.
And she knew she was having a heart attack. She went to the doctor, went to the emergency room. They looked at her. They said, you don't have any of the risk factors for somebody who has a heart attack. They sent her home. She had a heart attack.
Yeah.
So it's making sure that those underlying cardiovascular issues are addressed before you get pregnant. So making sure someone's connected to a medical home, that they're getting their annual exams on a regular basis, comprehensive medical exams to catch anything before they get pregnant.
Yeah, and sticking with that mortality piece, so Black women in the U.S. are 3 to 4 times more likely to die from pregnancy-related causes. What's behind this, and ultimately, what are some ways that we can go about fixing this? So
again, a lot of that is cardiovascular.
Yeah.
Not exclusively, but a lot of it. Some of it is, pregnant. First of all, people need to understand pregnancy is risky. It's dangerous.
Yeah.
In my case, I didn't have any underlying problems, but I had placenta previa, which is very rare. It's when the placenta is between the fetus and the birth canal. And so I woke up one morning bleeding, and I think making sure I knew that because I was going to regular prenatal care checkups. Not everybody can do that.
Sure.
And so I think making sure that we are addressing not only the pre-existing conditions, but that all pregnant patients are getting the prenatal care that they need.
Yeah.
Especially for older. I was what they call a geriatric pregnancy. I hate that term, but making sure that they have comprehensive health care to provide all of the visits, the screenings, the testing that they need.
And we've already you've touched on this in the numerous of questions we've asked so far, but it's impossible to fix these things without this full spectrum approach. Is that
That's exactly right. That's exactly right. And I think, and recognizing how insurance coverage fits into the picture.
Gotcha.
Because you are much more likely to have a pre-existing condition. You are much more likely to have a poor health outcome if you don't have health insurance. But we also need to look at environmental factors. And I think a lot of people don't do that. But if you live in an area that has a lot of air toxins, whether it's from, if you live near a power plant, you live near fossil fuel burning power plant, you live near a chemical plant, all of that impacts your health and your pregnancy. And so recognizing that healthcare is in a silo.
Yeah.
We don't live in silos.
For sure.
So we've got to look at the comprehensive, all things that impact your health, gun violence, mental health, all of that impacts whether you're going to have a successful pregnancy or not. I saw one study in Maryland at one point, the number one cause of death for pregnant women was gun violence. So we cannot look at healthcare and maternal care in a vacuum. We have to look at the comprehensive picture.
And again, you've lived this in a very real way, having spent time in the NICU and also a premature delivery. What did that experience teach you about how our systems either support or fail mothers?
We have got to have, I think, full paid family medical leave.
Okay.
Not just for the mother, but for the father as well. I think, and the sort of counseling supports, the community supports. I think for me, there were a couple things. One, nothing is as devastating as walking out of the hospital without your baby.
Yeah.
Even if you know they're cared for in the NICU. But that takes a toll on you while you're trying to recover.
Yeah.
And in my case, I had an emergency C-section, so I needed to physically recover. But I also was trying to pump milk for my daughter. And I didn't have to worry about the fact that I had health care that would pay for that stay.
Yeah.
The average NICU stay is 5 figures. And it ranges, but that's a lot of money.
Yeah.
And I didn't have to worry about how am I going to pay for this because I had employer provided insurance. Also, there are a lot of people who that hospital and that NICU is hours away from where they live.
So the access piece.
The access piece, so making sure if you are living far away from that NICU that you have a place to stay nearby. These are all things that I think we need to focus on so that the parents should only have to worry about, the mother, her recovery and her baby.
Yeah.
And the father, taking care of the mother and the baby, and not how am I going to pay for this? Am I going to be able to get time off from work? Will I be able to pay my bills if I get time off from work? How am I going to? And especially if you haven't, I had a 4.5-year-old.
Wow.
So it's like, can I afford childcare if I have to be in the NICU all day and my husband has to be at work? Like these are all things you shouldn't have to worry about.
Surely. Yeah. And what role does trust or the absence of it play in how people navigate through the maternal health system?
Trust is critically important.
Yeah.
You have to have a provider. You are literally trusting them with your life and your baby's life. And so you need to know, if you walk into their office and say, I think I'm having a heart attack or something's wrong, that they're not going to dismiss you.
Yeah.
And that they're going to if there is nothing wrong, first they're going to make sure nothing's wrong, and then they're going to sort of assure you, and they're going to help you see, here's what to expect every step of the way.
Yeah.
I had that trust with my doctor.
Yeah.
Not everybody does.
Surely. And veering in a little bit into the policy aspect of your work, and so you've helped lead Virginia's work on a state level Momnibus approach, and you support the federal Black Maternal Health Momnibus Act. For listeners who may not know what that is, what are these types of bills trying to do in real life for families?
I think they're trying to address those underlying systematic issues that we talked about. So investing in the healthcare system, in prenatal and postnatal care, in making sure that mothers are healthy before they get pregnant, is the big picture for these bills, in making sure that providers have appropriate bias training, that they're culturally competent. Those are sort of the big picture of what these bills are doing. And then, making sure you have insurance that covers everything.
Yeah.
The Affordable Care Act did a pretty good job, but not all of our federally provided programs do. So making sure that pregnant women have the resources that they need for a healthy outcome.
Like you said, that cultural competency aspect, and there's potential language barriers possibly as well. So all these things play a critical role. So Virginia's extension of Medicaid coverage into the postpartum period is a major shift, as we've spoken. What does that mean for families, and where do you still see coverage or access gaps that policy has not yet closed?
Medicaid expansion connected people who make too much money for traditional Medicaid, which covered a very limited population of people, making sure that they have insurance and are connected to a medical home is critically important. And we have seen that population has better outcomes because they're not getting as sick, because they're getting that preventative care. And when they have an issue, they don't have to wait until the last minute to go to the emergency room. So that's sort of expansion, the expansion under the Affordable Care Act. For postpartum expansion, it is making sure, the most maternal deaths occur up to the first year postpartum. So if your health insurance cuts off, 6 weeks, 6 months, and then you have that heart issue, you're out of luck. So that's why that was critically important.
And you also introduced legislation to provide child care support during prenatal and postpartum appointments. Why was that important to you?
I mean, again, you should not have to worry if you already have a child. You should not have to worry about, can I afford childcare? Can someone take care of this child while I am trying to go to the doctor, get these appointments, and recover postpartum? So it takes one stressor off of the family. And as a member of the Black Maternal Health Caucus and someone who has worked on maternal health for many years, what are your top priorities in Congress right now to protect and improve outcomes for mothers? Right now, that's shifted with the current administration, because the devastating cuts to Medicaid are going to lead to fewer people having insurance. And the expiration of the enhanced premium tax credits under the Affordable Care Act, we were already seeing, are causing people not to be able to afford health insurance. So we're backsliding on addressing, insurance coverage. So my number one priority has been fighting that, and then once we are able, restore what we had before those cuts. Separate from that, we were making real progress addressing the underlying disparities, but a lot of the cuts and this war on DEI has meant We don't have the data being collected that shows us the underlying reasons real time. We've seen, again, some postpartum deaths are due to substance abuse. We've seen significant cuts to the federal workforce that tracks that data, that provides and implements the policy recommendations to address it. And so really making sure that we restore what we had and then build on it.
Yeah. And back to the full spectrum aspect, mental health probably plays a big piece this, right, as well.
Yes.
So can you touch on that a bit about how?
It plays a huge part. I mean, again, some postpartum deaths are due to substance abuse issues or suicide, rooted in mental health, because a lot of people turn to drugs to self-medicate because they don't have access to the mental health services that they need. So they turn to things that end up killing them.
Sure.
Or, postpartum depression is real. And when it is not addressed, it can lead, worst case scenario does lead to suicide. Yeah. And so we've got to address both of those issues. And then again, you have some people who are already, addicted before they get pregnant. And that is something that you need to be able to address as well.
Got you. And for people who are listening who are not lawmakers or clinicians, what is one concrete thing you would invite them to do to push maternal health forward in their own community? Talk
about it, first of all. First, again, recognizing that pregnancy is risky, that pregnant patients need community support, they need systemic support, you heard the whole, it takes a village to raise a child. It also takes a village to support parents. And making sure that you're raising awareness about these issues. So in Virginia, I passed a bill that designated November as Prematurity Awareness Month. I did the same thing in Congress. I also passed a resolution designating August as Breastfeeding Awareness Month. And so all of these different awareness issues, just educating yourself in the community on the fact that we have, a maternal health crisis. The March of Dimes just issued an annual report on maternal health, preterm birth, and infant mortality rates. And America got a D. And I think, reading that report, looking at some of the underlying issues, and then either supporting policymakers or organizations that are advocating to address these issues.
I mean, it's been a while since I've been in school, but C is at least the passing grade. You would hope to try to get. The D is just
well, and there's some areas that, in Virginia, in Central Virginia, they got an F.
Wow.
So we got a long way to go.
Indeed. And when you think about, to that point, the future of maternal health in Virginia and across the country, what gives you hope right now?
I think what gives me hope is there's a greater awareness about the need for action than ever before. The problem is the chaos coming out of Washington and the impact that a lot of those policies, whether it's, again, cuts to the federal workforce that was working on this issue, cuts to the funding for closing the insurance gap, that's made it a lot harder. But again, there's more awareness and will to fix it than ever before.
Awesome. And as we close, and again, thank you for lending your voice to this conversation. And you do a lot of education on this topic, from your newsletter to social media. What are ways maybe people can follow you and keep up with these?
Absolutely. So my website is mcclellan.house.gov. That tells you all the ways to find me. So if you don't remember anything else, remember that. But you can sign up for my newsletter. I'm on social media at Rep McClellan. I'm on everything except TikTok. Maybe eventually. Sure. But those are the best ways to follow me.
Perfect. Well, again, we would like to thank everyone that has tuned in to the Virginia Community Healthcare Association Maternal Matters podcast series, where we have been speaking about access when it comes to maternal care. And again, Congresswoman McClellan, we'd like to thank you for stopping by.
Thank you.
Appreciate it.